Welcome back to Well and Worthy Life. Today I have a guest that is a repeat guest, and you may have, gosh, I can't even remember when she was on. It's been a while though. Dr. Kassie Dewitt. And Kassie, thank you so much for joining me today.
I am so happy to be here.
So we're talking all about pelvic floor, and if you haven't started following her Instagram by now, you've got to follow her Instagram, because after looking at all her reels, I realized I'm doing a lot of things wrong. And it's funny, Kassie, because, or should I call you Dr. Kassie? Really,
No,
Dr.
Cassie is
Kassie.
plenty. Cassie is plenty. Thank you.
I'm like, so I was thinking about, I have never really thought too much about pelvic floor health, to be perfectly honest, until recently, really till hitting really that perimenopause and menopause. And I had lower back pain, probably about, well, it's been going on for a while. And so I went to a pelvic floor therapist here in Birmingham. And that's when I heard the terms prolapse. And it kind of like, oh. And it was, so I worked with her. I luckily did not have prolapse really bad. And I really don't think, after working with her some, that my back pain was related to that, which I was very glad. And I really don't have the problems that a lot of women do have, is this leaking urine. But I do have some other problems that I want to talk to you about.
Yeah.
But let's just kind of define, first of all, tell everybody your background, how you got into pelvic floor health, because that's, I mean, like, what would make you want to go into this?
Yes. Okay. Hi, everybody. I'm Dr. Kassie Dewitt. I am a doctor of occupational therapy with a specialty in pelvic floor rehabilitation. And my pelvic floor dysfunction can hit you at any age. So mine started when I was 16. And I remember serving a volleyball on, I was athletic, ran track, played volleyball, cheered. And I remember serving the volleyball and leaking urine. And I thought, I think I just peed my pants, not having any idea what would cause that or what was going on. I would tell all my teammates, I'm just very sweaty. It was humiliating, right? At 16. And also when I started my period very late at 16. So that's when all my pelvic floor dysfunction really started happening. By the age of 18, I was full blown emptying my bladder, had times where I was running on the treadmill and there was no way of holding it. This obviously way before, I didn't have children until my mid 30s. Horrific endometriosis, terrible periods, terrible pelvic pain, constipation, pain with intercourse. And 22, I had been to see the doctor several times, and I was just told that I needed to try a new medication, a new birth control. I was put into menopause at 23 to see if that could help. Had 3 different surgeries, and not anything was said to me that was beneficial, that was helpful in the quality of my life or functionality. It was just medication after medication after medication. And so you develop these habits that just make your pelvic floor dysfunction worse. For instance, peeing just in case. I'm going to pee before I go somewhere because I don't want to go out in public and sit on a public toilet, or I don't want to have the chance of leaking urine, or I don't want to change a pad out in public. So I started peeing frequently, as much as I could, to limit the urinary leakage. And that just made my pelvic floor kind of scrunch up and had really little range of motion, which caused the pelvic pain, the pain with intercourse, made my periods even harder than they already were. So it was just this downward spiral. I remember going to a physician and saying, I'm peeing on the treadmill. And she said, oh, you're just getting a really great workout in. And me being 21 thinking, okay, well, now I just switched my relationship with exercise, because if I don't pee my pants, then I'm not working hard enough. And so that played some mental games on me too. Anyways, fast forward, I still just suffered really till I was 27 years old, and I started my doctorate program as an OT or started to get into OT, the master's portion. And I thought, okay, what is this pelvic floor? That is really interesting. And when I went, I was like, this is what I'm here to do. This is exactly what I'm here to do. And now I have a very healthy, strong pelvic floor. I've had 3 C-sections. I don't leak any urine. I'm not on any medication. I have, I'm not perfect at all with my pelvic floor habits, but I am super aware and I want to be prepared going into perimenopause and menopause, like we're going to speak about today. So yeah, that's a
Wow,
little bit about my backstory.
that's a story, right? I mean, my
Yeah.
gosh. I mean, you're right to be so young, and you hear about women leaking urine, especially after having children. You wouldn't even
Mhm.
think about that. And until I watched some of your reels, I never would have thought about our habits. And I know you even talked about on one reel the way we were potty trained. Oh,
Mhm.
and I have a granddaughter. She is
Right.
potty trained. And I thought about some of the things that even me, I would say, well, let's go to the bathroom before we go to the park so that
Yeah.
we don't have to go just in
Right.
case. And I do this all the time too.
Right. I think before I'm anything, I'm a mom, right? So
Right.
my momness steps in and I don't want to take 3 kids into the Target bathroom. My son
Right.
is everything. He puts it in his mouth. I've got a baby. My daughter she's not big enough to get on the toilet. So she puts her hands over. So I get the convenience of let's
Right.
go potty before 100% get that. But I still try really hard to build that relationship with their bladder and brain. And I say, what is your bladder telling you? Be very respectful to her signals or my son has this urgent, they don't want to stop
Yeah.
playing.
Right.
They
Right.
want to keep
Yeah.
playing until their bladder is like, ah. So then we're rushing to the bathroom. So, or kiddos with any kind of anxiety. I was talking to my girlfriend today before we got on, and her son came in. The bus was coming, and this happens every single morning. And that trigger of the bus coming makes
Yeah.
him feel anxious, and that's going to spark urgency and going to the bathroom and rushing. So, there's a lot of moving parts when we're moms and of littles, especially, or grandmas, where we just have to be very cognizant of, okay, is it the worst thing if they have to go to the bathroom at the park? It's not convenient. I don't want to do it, but I would rather have them say, oh, my bladder's telling me I need to go, so I'm going to go. I
Right.
also understand the difference in personalities. I have a type A firstborn child who is very particular and is a great listener of her bladder. And then I have a middle child boy who is like, wow. So I get that. Like, I totally understand
Right.
that. I just try
Right.
to use vocabulary that's helpful
Yeah.
with
Okay.
them.
And so it made me think about how children don't like to have bowel movements
Yes.
at school and at different places. And so I
Mhm.
would think holding that, in fact, I know adults that hold that too
Yes.
because they
Yes.
don't want to do that. That's
Mhm.
probably not good health either, pelvic floor health, right?
No. And I also understand that side of it. So so the bladder will send you 3 signals saying, hey, I just wanted to let you know that I have fluid in me. The second signal is, let's make a plan to get to the toilet. And the third signal is like, girlfriend, you have waited too long. And with the bowel system, we typically get 1 signal.
Mm-hmm.
And so we can listen to that signal and go empty, or we can be at a dinner party or a place that doesn't have a potty, or any circumstance where it's not convenient to go to the bathroom. Well, bowel either will go, it doesn't disappear, it's still there.
Right.
That signal will be more quiet and that bowel will go back in, and that can confuse the brain a little bit in terms of, hey, we're full and we're not going to the bathroom. Okay. And that can cause constipation.
Mm-hmm.
Or we can be rushing, saying this isn't a convenient time to have a bowel movement. So we get on the toilet and we push really hard, which can cause pelvic organ prolapse for women. So we don't want to do that either. So it's just really good to be cognizant of what's going on in the pelvic floor organ system.
And can you train yourself to empty your bowel and your bladder at a certain time of day?
The bowel actually likes a very detailed schedule. So many of my women who have really healthy bowel movements will go to the bathroom every morning at the same time, like clockwork. And it's just kind of a system they've put in. And so I think you can absolutely train your bladder to go and bowel to go at certain times. I think it's part of the bad habits we can create, and but also can be really great habits that we create. So for instance, my teachers or my nurses or our nurses is a big one where they won't go to the bathroom all day. Or my teachers are like, I can go to the bathroom one time and I'm pushing and rushing and that's it. And those bladder habits are really hard to untrain, but really critical to untrain. So yeah, I think a schedule is what we all try to do as much as possible. When we get off that schedule, that can create anxiety and urgency will kick in, because urgency doesn't have anything to do with pelvic floor strength, has everything to do with the mind and bladder communication.
Yeah, so that's what I saw on your reels, and I was like, wow, that is so interesting. And you were talking about breathing, diaphragm breathing and stuff like that. So
Yes.
I love that. Okay, so let's talk about though, what happens when women start hitting perimenopause and menopause and start having more problems? What are some of the problems that they can have?
So when we're hitting that perimenopausal, menopausal phases, we know that our hormones are kind of all over the place. They're depleting more so when we get into menopause. They can be surging, depleting, and perimenopause. And those are the things that I always tell my patients and clients, that it's really important to control what you can control, right? So we can control our diet, our sleep, our stress, our hydration, and our movement. And when we are optimizing those things, our body is more in a homeostasis pattern, which is fulfilling to it. So you might not have as many of the symptoms as someone who is eating more of a processed food diet or drinking the carbonation, alcohol, or caffeine that causes inflammation of the bladder. But we all go through where the hormones are depleting and we can't, and they don't come back. So we have to make sure that those 5 things are in line with what supports our system, but then having good healthy bladder habits before we get there is very helpful. And then using methods like a good lubrication or a safe pad to catch urine if you're in the process of training your bladder or training your pelvic floor not to leak urine. Or training your bladder not to leak urine and training your pelvic floor to be stronger. So self-care is a really important aspect of the perimenopausal and menopausal phase. So when I teach my women who are going through that kind of shift, I think I'm knocking on that door. I'm going to be 39 next week. And so I'm knocking on that door a little bit. I think it's really important to, one, understand what the pelvic floor is and that we all have one and its function. So it's 3 layers of muscles in your pelvis, and it has 5 functions. Sexual function is that first layer. Second layer is a sphincteric function. So it's going to open and close the sphincters when we want it to. And then third is that big support layer. It's going to support the uterus, the rectum, the bladder. They all work together as a sump pump to pump blood flow through there to feed the muscle tissue that also helps with orgasms. And then they all work together to stabilize the hips and spine. So understanding the functionality of the pelvic floor, really critical. So you can say, I don't care what age I am, that's not a normal function. That's not what it is supposed to do. So that's one of my biggest questions. Yeah, but I'm 65 or I'm 77. And I say, well, as we age, it is harder to build muscle due to the hormone shifts, but not impossible. So working towards optimizing that function through good habits on the toilet, good posture on the toilet, and then a strong pelvic floor is really the most advantageous avenue we can go down with the menopause and perimenopausal stages of life.
And so so I love that you say the first thing to do is, some pelvic floor exercises. You have your own course too, where you teach how to change your
Right.
habits, right?
Yeah.
And exercises. And tell me a little bit about your course.
So it's a 11 module course that, because my number one DM every day is, what exercises can I do? I think we're
Mm,
always so hyper focused, and you know this in the wellness industry, we can become very hyper focused on exercise and what exercise can I do to stop this and or to lose this, right? So I spend 8 modules of the course talking about anatomy, physiology, functionality, habits, nutrition, hydration, how to train your brain with frequency and urgency. The habits we have and routines we have are what sets us up for the exercise portion. Pelvic floor strength is so critical for organ safety, and so we don't leak urine or bowel, of course, and stabilization. But it's our habits that really come into play that we forget about. It's like, if you want to lose weight, we can't just go to the gym. We have
right.
got to look at nutrition. We have to look at sleep. We have to look at stress. We have to look at all these other things. And then the gym is like the fun part, the okay, I get to move my body and that's a
Well,
gift.
for some people, it's not
For
for
some,
everybody.
right. Um, and it's not always for me, depending on what phase or cycle I'm in through the
Right.
month. So, the first portion of the course is talking about how to train your bladder and
Mhm.
introduces you to the anatomy physiology portion. I go through a whole module of diaphragmatic breathing to make sure that coordination patterns between your diaphragm and pelvic floor are really great. That also helps with urgency, calming the nervous system. And then we talk about the bonus module is self-care products and what's important to
Mm.
use and what to look for in terms of protecting our vulvar tissue. So it's something that I created out of so much love and passion, and I have just enjoyed being that place
Mhm.
for women to fall when they need
Yeah,
it.
I love that because I do think, didn't even know there were pelvic floor specialists.
Yes,
So, and not every area is there probably one, I would doubt,
right.
and so, it is great if you can find somebody in person to go to, but
Absolutely.
if you can't, this is a great alternative, or you can't, just for whatever reason you work too much or
Right.
whatever. But just what you're talking about pelvic floor health, I just can't help but think about with balanced wellness method. I mean, it's all the same stuff, right? It is about our lifestyle and what are we doing for our lifestyle, and
Mhm.
things change once we hit perimenopause and menopause. So if we keep
Right.
doing things like we always do, we're not going to get the same results. And it sounds like with pelvic floor, the same thing. We've got to change things up a little bit because
Mhm.
let's face it, as we hit perimenopause and menopause, we are losing the estrogen, we're losing our hormones are fluctuated. And then when we're in menopause, if we haven't started hormone therapy,
Right.
we are getting our everything, the vulva is drier, everything's drier, it's
Mhm.
just thinner, that whole skin, everything about it. So, and that's when, I hear people have painful intercourse
Yeah.
and, all kinds of issues. So, knowing the right products to use, because we don't want to just pick something up at the grocery store,
Right.
I mean, it may not have a good ingredient in it. It's just
Right.
like the foods we eat. We have to read our labels. We talk
Right.
about that in balanced eating method. I mean, you're still, any product you're putting on your body, and especially if you're putting it up inside your body, you
Right.
really need to pay attention to it.
Yes.
So, what are some of your favorite products?
So let's start with just a generic pad. If you're catching
Okay.
urine with a pad, or if you're in perimenopause and you're still having regular cycles or cycles at all, sometimes they're not regular, sometimes
Right.
they are regular, but you need to be buying an organic pad or tampon to be using, because cotton is grown in field, it's sprayed with pesticides, they take it to a factory, they dip it in bleach, and we put it next to our tissue, and our vulvar tissue, which the vulva is the outside of the vagina. The vagina is a vaginal canal. So many people
I think
It's
we've gotten that so confused. I
so
didn't know that
confused.
until
Yeah,
recently
yeah,
either.
yeah.
I'm like,
It's so confusing, and so many people just refer to the vagina, and then if I just refer to it as a vagina, people are like, "It's not a vagina, it's the vulva." So I'm like,
I know.
"Okay." The vulva tissue is extremely absorbent, and the last thing we want it to be absorbing is yucky bleach chemicals, right?
Yeah.
So when that happens, it changes the pH balance of the tissue, which then the tissue is now at risk to have more infections. It's not as strong, so intercourse can cause little lesions, or really any kind of penetration of anything can cause little micro tears that has bacteria seeping in. So you want to keep that tissue strong and moisturized. So
Mhm.
any product that I'm using, Lola right now,
Mhm.
is a pad. They're at every grocery store. You can find anything. Just make sure you read the label, because just because it says organic doesn't mean it's
We
right.
know that when we
Yeah.
look at labels on food,
Right.
right? It'll
Yes.
say healthy and heart
Yes.
healthy and
Yes.
it's like
Yes.
whatever.
Right. So I like Lola. There's seventh generation. There's Honest. I used the brand L for a very long time, and they're definitely not my favorite anymore. It's like even the organic companies can be tricky with what they're putting in their products. There's also period panties, there's period cups, all fantastic products. But again, read the labels on what's in them. And then for lubrication, if we're in perimenopause or menopause, for sure in menopause, we should be using lubrication no matter what, even with hormone replacement therapy, every time we're having intercourse. And lubrication goes on the man and the woman. Some of my favorite lubrications, especially for menopause, is Good Clean Love. It's a water-based lubrication, and I love that. You can use that. But as for a daily moisturizer, I think coconut oil is my absolute favorite. So you can put that on morning and evening. And there's also a product called V Magic, which is a vaginal moisturizer, but I love coconut oil because you can cook with it too.
And
Like,
somebody said to me that you want to put it on from your anus all the way up. So do you think that, or do you just put it on your vulva?
no, I would put it on all the tissue. I thought you
Okay.
were talking
Yeah.
go from
Yeah.
anus
No,
to
no. Yeah.
go front to back
Yeah.
still.
Right.
And
Okay.
then,
Everything.
yes,
Okay.
all that tissue.
Okay.
That's
Okay.
fantastic. Yep.
Okay.
Mhm.
Yeah.
And it's safe to put inside. What we don't want to do again is change the pH. I
Mhm.
tell my women the vagina is a self-cleaning oven. It knows what bacteria it needs to clean out all the yucky stuff. We do not need any soap or products that say pH balance. It's the same with food, right? Like heart healthy doesn't really mean
Right.
heart healthy. pH
Yeah.
balance doesn't really
Exactly.
mean pH balance, because our bodies can do it itself.
Mhm.
So making sure that nothing is going past labia majora, which is your outside lips, labia minora on, that is can be taken care of itself. So I know women are like, "What? You don't put soap past that?" And I'm like, "No, because that will change the pH. Even if you're using like the most modest soap,
Mhm.
soap generally has a pH of 7. It's very drying. So the last thing women who are
Yeah. We
having
need to do is.
vulvar dryness is to put more soap to dry the skin even more."
Mhm. Oh, yeah. Okay, so I love that. Okay, and let's talk about the other problems we have in perimenopause and menopause is we're waking up more now than ever before, except maybe when we had our babies,
Yeah.
right? When you have babies, you're waking up all the time, but
Yeah.
it's because you have a crying baby. But because everything's kind of, our hormones are all messed up.
Mm-hmm.
And so I have found myself, I wake up in the middle of the night and I have trained myself where I can go back to sleep. But
Mm-hmm.
usually, if I wake up in the middle of the night, I'm like, I'm just going to go
Might as well go
pee.
pee.
Yeah.
Mm-hmm.
So
Mm-hmm.
I might pee 3 or 4 times a night.
Yeah. So that is, see how important habits are that
Mhm.
we put on it's the same way with a breastfeeding mom, or not even a breastfeeding mom. I breastfed, so that's what I connect with. But feeding a baby in the middle of the night, period,
Mhm.
you're like, oh, my bladder is telling me I need to go to the bathroom, and we start that habit. And then same
Mhm.
thing when sleep gets disrupted. So we can carry that habit
Mhm.
all the way through our life and get up 3 or 4 times a night. The normal is no more than 1 time a night. And I would like my people not to get up at all. That would be
I
fantastic.
would love that. I
Yeah,
would love
everybody
that.
would just to sleep
Yeah.
through the night. So when that urgency or that habit falls into place, you're waking up 3 or 4 times a night, I would encourage you not to use the restroom because your bladder is equipped with not having to empty at nighttime. So going back to sleep and seeing if you can push or at least eliminate one of those bladder emptyings. Now, I wouldn't say, okay, I get up 4 times a night. I'm going to not go to the bathroom all night. You'll be miserable and you will leak urine most likely. So I would start off small and try to just to eliminate one of those. Maybe the first time you wake up, say, okay, I don't need to go right now. I'm going to wait till the second time I wake up.
So does it have anything to do with how much water? Because I just thought it was just because I just drink so much water all day long.
So that is probably my second question, but I drink a lot of water, and our body is 60-70% water, and we need a significant amount of, I like electrolyte water more
Yes.
than just plain
Yeah.
water, but we can get really obsessed with, here's my take on water. We can get very obsessed with drinking so many ounces per day. So like I have to drink 100 ounces of water, and we become obsessed with a number instead of committed to hydration. So our body's biofeedback will tell us when we're hydrated, like our skin is not dry or our lips aren't dry. Or for me, I know when I'm hydrated, my feet get really flaky and just almost so dry. And I'll say, okay, I need to up my water intake, but I am a firm believer in drinking water with magnesium, sodium, all the electrolyte water to fill in those minerals. Plain water can actually strip those minerals away. So
What's your favorite electrolyte that you use?
I like LMNT.
Yes.
I
Me
like
too.
that.
That's my favorite. Yeah.
And when I first started, I would dump like a whole thing of it and I hated it. I love plain water.
Yeah.
So I just hated it, but I knew I needed the minerals. So I started off just doing a little bit of the packet and then just worked up.
Okay. Yeah.
Yeah.
I love it so
Some
much.
people
It
love
makes
it.
me, I do. I love it. It is salty. My husband, every time he takes, it's like, oh, I'm
Yeah.
like, no, it tastes so good.
My
So,
husband had a stomach flu yesterday, and so I was like, you have to drink this water just to, and he was like, I can't believe how much better I feel just by drinking this electrolyte water.
yeah.
So I've also tried, I think it's called Relight or something like that, Highlight, anyways, on Amazon, and that's fine too. But what happens is we decide, and first of the year is a big time where people are like, I'm going to get healthy, and the first thing I'm going to do is I'm going to start drinking a gallon of water a day. And your bladder is like, excuse me, we have been like drinking 10 ounces,
Right.
drinking a gallon. And so then people are like, of course I'm in the bathroom all the time because I drink a gallon of water. So when I am helping women figure out what water feels good to them, the amount of ounces, we start with, okay, what do you drink consistently? Okay, I can drink 20 ounces of water consistently. And so then we go up by 10 ounces and we do 30 ounces for like a week, maybe 10 days to allow bladder to get used to that. And then we can add as we go. But we need to be very cognizant of water consumption with bladder too, because it's not used to holding that much. Now, if I drink in the morning, here's an example. I'll get up and drink 30 ounces of water. I'm drinking high volume and I'm drinking it fast. And bladder's like, well, good morning to you too. But that is in my head where I have to drink the water before I can have my coffee, which is a bladder irritant, right? So average, what is considered normal is going to the bathroom 5 to 7 times in a 24-hour period. And by 8 a.m., I've already gone 3 times, right? Because I'm my bladder, I'm putting a bladder irritant in it. So it wants everything out of me. But the rest of the day, I'm kind of fine. I go maybe 7 times a day. I do not wake up and go in the middle of the night. Now, with that being said, I'm a mama of 3 babies, and getting rid of my caffeine in the morning, my coffee, is not worth it to me, right? So I'm not perfect by any means with my pelvic floor health or not ever consuming anything that irritates my bladder. I tell people you got to kind of choose your evil. Be aware, okay, drink the coffee, I'm going to go to the bathroom. And if you're okay with that, then I would say just let that fly. As long as the rest of the day you are practicing really healthy habits.
So what are some other irritants besides coffee?
Mm-hmm. So the nutrition side of bladder training is ding, and nothing is really, you've heard spicy foods or really acidic foods, and for each person it's so different. But one of the most evidence-based article named carbonation, caffeine, and alcohol as being known to inflame the bladder. So people ask often, when I drink alcohol or glasses of wine, I'm up all night. And I say, well, wine, alcohol is going to disrupt hormone function, right? So
Exactly.
you got that. So it's going to add to the insomnia. And then it's also very irritating to the bladder lining. So when you're drinking the wine at night, you have to weigh that quality of life. Is it worth it? And some people are like, absolutely. And I'm like, then you have to do that. Just like me with my coffee. I don't consume alcohol, but I do drink my coffee. So I think it's just something you have to be aware of and then choose your evil.
I think that's the whole thing. And we're all so different. So, there's no right or wrong. It's about choosing what, if you know the consequences, then, and you still choose, hey, that's okay. I mean, sometimes I eat cake. I mean,
absolutely.
You know what? I'm not gonna, and I'm gonna drink coffee, and
absolutely.
But I choose most of the time I'm going to choose no alcohol because of the way it does affect me. It's not worth it to me.
Right.
But some people would say it is worth every minute. They'll go, I'd rather give up coffee.
Yes.
So
yes,
it is
that's the thing.
I think that is the key to it all. And I love the other thing you were talking about is that you go gradual up. You don't do this. I think, so many people, whether it comes to diet or getting healthy or whatever, it's, I got to do it all or nothing. I got to be perfect or nothing.
Right.
And that's where we get that's why we don't stick to it. I mean,
Absolutely.
let's just face it. That's why we are where we are. And that's, those are some of the things that we work on and in balance is because, I mean, it's really universal no matter what we're working on in life,
Right.
So it's that mindset, that losing that all or nothing mentality. Like, no, make those small changes.
Yes.
The small changes that you do consistently will add up.
Yeah. I think that is so underrated. Right. The mindset of this perfectionism and the all or nothing and the rush to lose weight or to stop leaking urine, or it's like we're so hard on our bodies for so long. And then we expect in an instant that I was one of those, like I yo-yo dieted for years until I was like, that doesn't work. So I've got to change that. And it was the same thing with pelvic floor health. You're not going to, I get asked often, how long does it take to stop leaking urine? And I'm like, how long have you been leaking urine? And what's your, I mean, there's no timeline until your body is equipped with the necessary bladder habits, routines, the pelvic floor strength. Then, I mean, give your body some grace. Like she shows up every day for you. So give her some grace.
But we are so hard on ourselves. If our friend did the same thing, we would give her a break. But
absolutely,
it is showing that self-love to ourselves that we would show to our friends. And honestly, I do think sometimes I find that the older we get, the harder we can be. It's either the harder you are or you finally learn, I got to give myself a break on this. I'm not, and I think there's so much freedom in that.
So much freedom.
Don't you say when you quit yo-yo dieting, it's like, oh, hallelujah. I don't have to, like, January comes, I'm not like, oh gosh, what's the next diet out there? What am I going to do?
Or a vacation comes and you're not panicking 2 weeks before trying to get from a size 10 to a size 4. Like there's not, I always tell myself now, because I was very hard on my, I think women are in general.
Yes, I agree.
And I have really worked hard on anything. I will not look at my daughter in her face and say it to, because I would never want to harm her whatsoever. I am saying to myself, and that has helped so much that I'm just not ever going to say anything to her that isn't encouraging and loving and supportive. And if she was, so my daughter is 6 and she still wears a pull-up at night, which is considered in the normal range. And I know grandma gets really like, why isn't she having a
Oh,
pull-up
I
yet?
bet.
And
Yeah.
it's like, it's a neurological function. It's her sleep. She sleeps really hard. And when she gets out of that, then she'll, I try to explain it, and she gets really down on herself. I'm just like,
Oh.
your body is working so hard for you. And just anything I would tell any of my women who are leaking urine, or my kiddos that, that's starting to become a thing. Well, none of my friends wear pull-ups at night. Like, it's okay. It's okay. You're working on it. It's totally fine.
Oh, I love that. I love that you're her mother, because I think some mothers would be like, no, or they might be putting them in the pull-ups, but they would be like, oh my gosh, feeling so alone. I bet you there are mothers out there like going, oh my gosh, something's going to be wrong with my child. I mean, I think that's what I would have thought. I mean,
yes. So she
yeah.
potty trained really early. And I'm also like I'm not a pediatric pelvic floor therapist. There are those out there, and God bless them. But I have studied a lot of pediatric pelvic floor. I just don't want to treat it. But the thing with that is there's so much brain communication connected to potty training and the habits we are kind of put on us, like we talked about earlier. So I think it's really important, mamas, that if your babies are getting up in the middle of, or not getting up and having a wet pull up, that is considered normal until the age of 8 or 9. And so instead of taking them to these doctors that will do pretty invasive tests, or putting alarms on their bed, or doing things of that, getting them up several times a night, I would just let them kind of transition into. My son, who's just turned 4, has never worn a pull-up at night once we potty trained. And it's just different. It's just different. She sleeps so much better than he does.
Yeah. Yeah. Oh, okay. So let's talk about this. Let's talk about, because I know women who have had surgery for this. And when do you finally seek surgery, or do you have to? I mean, what are your thoughts?
Depending on so a lot of people say, and remember, I'm a pelvic floor therapist. So what I saw was always the worst case scenario. What I do know about surgery, like a bladder sling, or if you have a prolapse, I think it's really important to know that medication and surgery never addressed the habits.
I think I saw you say a reel about that, and I thought, yeah, that makes so much sense, especially the medication, because you said something about once you go off the medication, you still have that, it's kind of like once you go off that diet, it's still working,
Yes, absolutely.
So
it's really important. And it's why in my course, there's 8 modules before we ever start exercising, because the habits and routines are so vital to the health of the pelvic floor organ system and the pelvic floor. So when you go in and you tell your physician that you're leaking bladder, and they give you a diagnosis of overactive bladder, and you get a medicine, or you do a bladder sling because you have a prolapse, or I have seen bladder slings done just because of frequency and urgency. Research indicates that pelvic floor rehabilitation should be attempted first. So now there's different grades of prolapse. So grade 1 through 4, and I don't diagnose these. This is something an OBGYN or a urologist can do. But grade 3 and 4 is something that typically needs surgery. So that means you can see organ at the opening of the vaginal canal, or organ is outside of the vaginal canal. So those are obviously, we want to keep our organs very safe, and surgical intervention would probably be most advantageous in. But that does not mean we don't go to therapy. So if you think about, if you have a rotator cuff tear, you go to therapy for like 8 weeks before you have surgery, and then you go for 12 weeks afterwards. So it's really important that if you do have surgical intervention, we need to still be addressing pelvic floor rehabilitation.
I am going to work on my bathroom habits, so that maybe in the middle of the night, I think honestly, a lot of times I'll wake up and I'm like, well, I'm awake, I better just go on and go.
Yeah.
And
Your bladder's
so
gonna give you that signal because
Mhm,
you have now woken up. Just like when you wake up in the morning, it's one of the first signals. The bladder's like,
mhm.
"Hey,
Yeah,
I'm
right.
full." So when you're waking up in the middle of the night, bladder's like, "Oh, we're awake. It's time to go to the
Mhm,
bathroom." So you're probably feeling that signal, but it can hold. It's like a
mhm,
bossy 3-year-old, right? I did a reel on
mhm,
this. It's like
yeah,
a
yeah.
bossy 3-year-old, and it will throw a tantrum, and you just have to train it not to throw a tantrum, and you be the boss of your bladder. And
Mhm,
some women say, "Yeah, but I have to like cross my legs and really hunker down." And I'm like, "I promise you, I can train it. You can train it no
mhm.
matter how significant." My oldest patient was 87. Her uterus was outside of her body. She wanted
Oh,
pain-free intercourse and she wanted to stop leaking urine, and she did both. So, and I think the other
wow.
thing with menopause too is orgasms can be much more challenging to achieve, which then makes
Yes, I would yeah, I
yes,
definitely
it does,
definitely,
because
yeah.
there's not the lubrication, there's not the blood
Mhm,
flow. So we really need
mhm,
to I feel like some of my job is to empower women or remind them that
mhm,
we do really enjoy intercourse. It's so good for us mentally, physically. It's
mhm.
one of the greatest pelvic floor exercises you can do, but you need to feel good and not do it as a chore. It needs to feel good for you. So many women, I actually want to make a reel on this too, to talk about their vaginas is so terrible because they've
Mhm,
had babies or they're have aged, and it's just like, you're still so beautiful, and you need to
mhm,
feel that during intimate moments, and you need
mhm.
to worry about how you feel, not how anybody else is feeling during that moment. So I think that's really important to understand and be equipped with that empowering. And you don't always feel that, but if you go
Well,
into
I definitely think, one of the things that I've experienced I'm 57 years old in menopause is the lack of libido. Luckily, it has started coming back for me, but it definitely takes me a lot longer to reach
Mhm.
orgasm.
Yeah,
So, I can't say that there hadn't been times where I'm just like, hurry up. Let's
yeah,
do
oh
this.
yeah, for sure.
I probably even did that when I was younger. Like, okay, I'm just not going to worry about me. But I
Right.
think that loving yourself enough to enjoy the moment, enjoy
Mm.
the feelings, all the feelings.
Mhm.
And yes, my sex life has always been so important with me
Yeah,
because with my marriage it's important. It's the one thing you aren't supposed to do with anybody else other than your
right,
your partner,
right.
and it is good for you health wise.
Oh, yes.
That orgasm, you release all the
Oh,
oxytocin, and and look, it's a great pelvic floor exercise.
perfect
So
pelvic
I
floor
think it
exercise.
is again, but it's going back to this mindset, and instead of like, oh, God, he wants it again, like, oh my gosh, or I remember feeling like I thought I could go without it the rest of my life because I just
Right.
wasn't getting that all tingly
Yeah.
feeling. And I was like, wait, what is this? This never been like this before. We talk about this in Balanced Wellness Method, and I think women love this because we feel like we're the only ones. Like
Yeah,
people don't talk about this with their girlfriends. They're like,
right,
"Oh, you must be doing it all the time," or "Yeah,
right,
yeah," And it's
right.
amazing the amount of women who stop, or the amount of couples, I should say, who just stop having sex. They stay
Mhm,
married, but
mhm.
they just stop having sex.
And I think a big area that needs to be addressed, I'm so glad you bring up hormone replacement therapy, because if you're a candidate, it is a fantastic route.
Hmm.
I think
Yeah.
so much literature was debunked that
Uh,
was
yeah.
discussed in the early 90s, and women are terrified. We don't want cancer either, and that's a big word
Hmm.
we always hear with hormone replacement therapy, but I think it's something to absolutely reach out and talk to your physician about. Not only are you a candidate, what do they offer? What are they willing to discuss with you? And I would find a physician who is willing to discuss hormone therapy, several different avenues of hormone therapy that could be advantageous for you. So when you don't have the estrogen that really makes you feel confident and sexy
Hmm.
and lubricated, yeah,
Right.
libido is gonna drop. So making sure and
Right.
always controlling those 5 things, right? But,
Right. Yeah. that
And
lifestyle. I mean, the
that life,
lifestyle is, yeah. Well, and I think again, in Balanced Wellness Method, we spend a whole week on hormone health and what to ask your doctor and all these things. We dive really deep into this. And that women's initiative that you were talking about, where people always, that was the biggest, one of the biggest mistakes ever. But
mm,
but unfortunately, it really happened with our mothers. And so many of the doctors are still trained that way,
yes,
that they're still thinking, oh no. So you could go to your doctor and ask them about hormone therapy and they could just shut you down.
yeah,
And I always tell everybody, no, 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 no. You go ask more and more questions. Even women who have had breast cancer can sometimes, not all the time. And
right.
again, I am not a doctor, so I do
Mm,
not, but I would definitely, I say, advocate for yourself, get
absolutely.
down to it, find what is going to work best for you.
Yes, absolutely. 100%. There is a protocol they go through to see if you're a candidate. And if
Mhm.
they're not discussing hormone therapy with you in several different avenues, giving you all the information, then you go to a physician who does, because
Yes,
nobody has to live in your body but you. And people, women can be in menopause at the age of 45. You have another 60 years
exactly.
to live. Like, do not live miserable or not being intimate with your husband or your partner. It's just really important, I think, to advocate for your health. I mean, so many people with pelvic floor will say, well, my doctor just put me on medicine. And this is not a let's talk about how terrible physicians are. A lot of times they just don't know any other avenue. So they're medical physicians. Medicine is their expertise. So to remember that you are your body's own expert. So if it's not feeling right or you don't want to do what's going on with it or the functionality, then you need to advocate for it. And if they say, here's medicine, be like, what other avenues can I do? Or even a Google search can help with different interventions we can do for urine leakage, constipation, hormones, libido.
Right. Yeah. And I agree. I think and these doctors, I mean, to be honest, they don't know a lot of
Mhm.
times, but even if they do know, they only have 15 minutes with you. They do not have a long time.
No, they
And
do
it's
not.
because of insurance
Yes.
and big pharma out there. I
Yes.
mean, that's how they get paid. I mean, that's how it works, unfortunately. And so you have to know that so that you can ask the right questions, you
Yes.
can get down to it. You have to advocate for
Yeah. And I
yourself.
think so many women, like you said, our mothers didn't know. I
Mm-mm.
remember my mom saying, you need a Kegel, and that means stopping the flow of urine whenever you're peeing. And now I want to be like, Mama, that was the worst advice you could have given me. But she didn't know any better, right? And we're not
Right.
taught in school. I think I made a course on period health because it blows me away
Mm.
how much we have no idea about our own menstrual cycles, or just
Oh,
like, just wear a pad once a month or a tampon, and
yeah.
you're going to feel like poop and you're going to have cramps and you're going to have all this. And it's just like, you don't have to have that.
Mhm.
So same thing with menopause, perimenopause, just really learn to advocate for yourself. And if there's a symptom that you don't like, let's chat about it.
Yeah, I love that.
Yeah.
Okay, so Casey, tell them exactly where they can find you. Tell them you're going to give us a code to have
Yes.
$100 off your course,
Yes.
and we'll have
Yes.
that all in the show notes. But tell
Yes.
them exactly where they can find you.
Okay, so my Instagram handle is at Mrs. Dewitt, Dewitt 22. I have an online course called Urine Good Company. It is for, spelled urine, good company. It is for women who leak urine. And it's a 11 module self-paced online course. And like I said, the first 8 modules are about habits and routines. And for your listeners, I would like to give $100 off for
Oh,
whenever.
yay.
Yes, yeah.
Okay, so all that will be in the show notes, guys. So be sure and check that out.
Yeah.
And you're on Facebook.
I am, and that's just Cassie Dewitt, Kassie DeWitt, DWITT. You can
Okay.
I encourage women to reach out and ask me questions. I want to answer you. And like we talked about before, I think online courses are really cool when if you don't have access to a pelvic floor therapist, if you don't have the time to go to a pelvic floor therapist, but not everything can be healed by my course. And I am very transparent about what I think is best in terms of your quality of life and what I think you should do.
Okay, one more thing. So
Yeah.
how would somebody find a pelvic floor
So you can
therapist?
go to, let me get the exact website for you guys. It is, let me see. Sorry. I just had it pulled up because
Yeah.
I can absolutely help you find a pelvic floor therapist if you reach out to me, but pelvicrehab.com will allow you to put your zip code in and it will pull up pelvic floor therapists near you. So want you, when you call and ask for a pelvic floor therapist, asking questions like how much of their caseload is pelvic floor rehabilitation? Have they gone through training? Are they a true pelvic floor therapist? Want to make sure that those questions are answered. Like my caseload when I was in practice was 90% pelvic floor. And I think that's really important, especially as you get into these more traumatic injuries.
Right.
For women and men, or women who deliver babies that are 12 pounds and,
Can't even imagine. Right.
yeah,
Yeah.
I know.
Yeah.
So very important to know the pelvic floor therapist that you're going to see has good experience.
Great. Well, Cassie, thank you so much for joining me today.
Thank
I
you.
really learned a lot. I'm going to be working on that nighttime, like whatever and I'll keep you posted on that.
So for the nighttime, Deanna, I
Okay.
want you to train your bladder during the day.
Okay.
So have really good, healthy habits during the day. So when nighttime comes around, you are more equipped because you have great, healthy habits during the day. Okay. Bladder is more tolerant, more stronger to withhold the urine.
Thank
Okay.
you
All
so
right,
much.
dear. I'll talk to you
Okay, guys, don't forget, we've got Balanced Wellness Method coming up soon. So if you're interested in checking that out, just go to the show notes on the link. Again, you can check out Cassie's course also. That will be in the show notes too. So, and yeah, always know that you can direct message us, either one of us. We are here to help you along this journey. And I hope you enjoyed the show.